blood pressure is also known as hypertension, and it is often called the silent killer because it typically does not show signs and symptoms. This means that you may have high blood pressure without knowing you have high blood pressure. Up until doctor checks your blood pressure in the office, when you end up in the hospital, or when you end up with a stroke, or when you end up with or you end up in the hospital with something called a hypertensive crisis. Hey friends, it's your friend and pharmacist Dr. Mo here. If you're new here, hello and welcome. I relate educational videos about medications. I talk about health tips and smart tips to keep you healthy. In today's video, I want to talk about high blood pressure, the silent killer, and why it is very important for us to know our numbers. So what is high blood pressure? High blood pressure is when the force flowing through the blood vessels is consistently high. And the numbers that make up blood pressure are the systolic and the diastolic. So the systolic number is always the number on top, while the diastolic number is always the number on the bottom. So what are the numbers and why are the numbers so important? I'm glad you asked. So normal blood pressure should be less than 120 over 80, which means the top number should be less than 120 and the lower number should be less than 80. For most people, not everybody, because there are some people whose blood pressure might be way lower than that, and that is normal for them, or higher than that, and that is normal for them. But in a normal person, blood pressure typically fluctuates throughout the day. If your blood pressure is between 120 to 129, and the lower number about 80, you have elevated blood pressure, which means it's tending towards the high side. Maybe it might be time to reevaluate some habits. Maybe it might be time to start making some lifestyle changes, particularly in the dietary aspect. Stage 1 high blood pressure is when the blood pressure is between 130 to 139. That is the systolic, the upper number, and the diastolic, which is the lower number, is between 80 to 89. This is when the doctor starts to get concerned. Some will put you on blood pressure medication right away. Some providers will give you the chance, the opportunity to turn things around, make a few lifestyle changes, and have you follow up within a month to a couple of months. When your blood pressure is about 140 or higher, or 90 or higher, this is stage 2 high blood pressure, and typically the prescriber will put you on one or more medications to help control the blood pressure. When your blood pressure is about 180 over 120 or higher, that is something called hypertensive crisis. It is a medical emergency. Typically, you will be taken to the emergency room. So what are the risk factors for high blood pressure? Risk factors would be if you have parents who had high blood pressure or some other kind of cardiovascular disease, the risk for high blood pressure increases. If you're somebody who smokes, that puts you at higher risk for high blood pressure. If you're somebody who's obese, if you're somebody who doesn't eat a healthy diet, if you're somebody who doesn't get any kind of exercising, all these things put you at a higher risk for high blood pressure. The fact that your parents had high blood pressure or high blood pressure runs in your family does not mean that you will get high blood pressure. It just means that you need to take charge and be proactive when it comes to your health. After all, healthy means heal thyself. So who should be checking their blood pressure? I believe all adults 20 and older need to be checking their blood pressure. High blood pressure typically presents in adults between the ages of 30 and 50. But that doesn't mean that anyone who's less than 30 can get blood pressure, or anyone who's older than 50 can get high blood pressure. But I believe that every adult needs to own a blood pressure monitor because you want to know what's normal for you. And even though normal high blood pressure should be less than 120 over 80, for most people, there are a few exceptions to the rule. And I want us to understand that whatever stage we are in, we could still make changes, lifestyle modifications. When should you be concerned? I believe we should be concerned when your blood pressure tends to run higher than is normal for you, which means that you have to be familiar with your normal numbers. Because if you don't know what is normal for you, you may not know what is high for you. So when your blood pressure starts to run higher than normal, you definitely want to be concerned. It could be due to a whole bunch of things. So you definitely want to find out what it is and see whether maybe by taking corrective action, you could normalize the blood pressure. If not, then you may want to seek medical attention, see your healthcare provider. So how do you prevent high blood pressure? Blood pressure monitor, You want to make sure you're constantly checking your blood pressure. Sure you invest in a blood pressure monitor. Having a blood pressure monitor and using the blood pressure monitor regularly would help you to know where you are, what your numbers are, and if you need to seek medical attention. And then that way you could do something about it by lifestyle modifications, especially when it comes to your diet, like not being so sedentary, getting some exercise in, by stopping smoking, by making sure you're incorporating a lot of vegetables in your diet. You're going for a checkup annually, or if you're doing any kind of drinking, if you're somebody who's stressed or who works a highly stressed job, cortisol is always going to be high. You want to get this down. So what are the complications of high blood pressure? Some of the complications of high blood pressure could be a heart attack, a stroke, vision loss, kidney disease or decreased kidney function, decreased sexual function, could also lead to heart failure. So remember that an ounce of prevention is better than a pound of cure. And in this case, prevention is you checking your blood pressure regularly. Prevention is you making major lifestyle changes to prevent you from getting complications with high blood pressure. If you're getting some value from this video, please go ahead and smash that like button. Don't forget to hit that subscribe button and turn on the notification bell so that whenever I release new videos, you will get the notification right away. Don't forget to like and share. It's free, all right? Like and share. If you got some value from this video, you will want to watch this one next. Thank you for watching.